Opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Ooh, it's getting hot in here.
Well, everyone's going to really...
Inner smile.
That's true. It is getting hot in here, and Dr. Mencia decided, I'm Anita Finley, and of course this is Dr. Andy Mencia, and...
C'est moi.
And he walked in and he said, okay, this morning we're going to talk about hot flashes, and I said to him, okay, do men get hot flashes? And
yes.
He said...
Every time a beautiful woman come by.
Do women get hot flashes every time a beautiful man comes by?
Sure, yes.
Are those the hot flashes we're talking about?
No, we're going to talk about hot flashes in general. Because, hot flashes can be devastating in a person's life. Of course, it's a lot more common in women. Sometimes we don't even think that men can get hot flashes. But we're going to talk about hot flashes, medication that can produce hot flashes, food that can produce hot flashes. So, it's important that we talk about them because there's a lot of physicians out there, men and women, that feel that hot flashes is just part of living, and you just have to live with them. And that is not so. You get many patients that can start getting hot flashes in their early 30s, and then they go through perimenopausal period. That's when they are losing their menstruation, and then eventually when they lose the menstruation, then in the women the hot flashes of course can get a lot more magnified. Not all women that goes through menopause will get hot flashes. It's genetically determined who is more prone to it or not.
I really didn't get them, and I don't think my mother did.
But there are many women that come to me in their 70s and 80s and say, Dr. Mencia, but they got it when they went through menopause, and then they come back in their 70s and 80s and they say, somehow I'm getting hot flashes again.
Maybe their youth is coming back.
No, that's why you need a good center like mine where people can come and get worked up and find out why they're getting hot flashes at any age, whether in their 30s, going through menopause, or in their 70s or 80s.
So you're saying they may have gotten them in their, let's say, maybe in their 50s, and then they get over it, and then it comes back again.
It can come back, okay? Because you'll see when we go through the causes of hot flashes, the main cause of hot flashes, you have in your body, in the brain, you have a thermostat. Okay, so when that thermostat, just like in your refrigerator, you have a thermostat, and in the refrigerator you can set it a certain level. If your thermostat breaks, it can cool too much, or it can warm up the food, and it can get rotten. So there are many things that can affect the thermostat. Now, the hypothalamus, which is a gland, is part of the brain, is at the base of the brain, can alter some of the hormones in a person, and that alteration of hormone, specifically when we're talking about estrogen and progesterone in women, in a man, the hot flashes is produced because of an alteration in testosterone. So it's that hormonal imbalance that will make us suffer from hot flashes as a consequence of the hormonal change. Now, little girls and little boys will go through alteration of hormone through their life, but they don't get hot flashes. The reason being is that when that alteration of hormone at any age, from birth to death, when that alteration is very mild, the body will adjust to it. When it's a sudden drop, then you will experience hot flashes. So when a woman comes for a workup for hot flashes, one of the questions you want to bring to your doctor is, have you stopped taking a hormone replacement, and did you stop suddenly? Did you just run out and didn't decide not to go back and refill your medication anymore? That would be a reason why many people will get hot flashes. So a man can be taking testosterone replacement that usually come in an ointment, and they put the ointment on, and somehow they run out of the ointment, and guess what?
They lose their testosterone.
Yeah, they lose their testosterone.
And so now they're not able to really have an erection. For them, it shows up differently, doesn't it?
It's going to be a huge deficit, and they will get the hot flashes, just like women.
That means that they get hot and they get cold.
Hot flashes, the definition of hot flashes is are sudden feelings of warm, and it's more pronounced on the face, the neck, and the chest.
Okay.
They are produced by profuse sweating,
right? And
it may leave you chill. So you feel like, after the sweating, you feel like you're so cold now. So that's why, it's so, it can affect your quality of life.
Yes, disconcerting. I'm sure I actually saw someone, just the sweat coming down their face.
Exactly.
And so, what would someone? But now you're saying that it could be caused by what you said, that if someone hasn't been taking their hormone replacement. But can it just be caused all of a sudden when they never had it before and they're not taking any?
Yes. And it can happen at night. So night hot flashes.
Night sweats, is that what they call
what we call those night sweats, right? The night hot flashes can, of course, alter your sleep. Right, so you won't be able to sleep,
right.
And it becomes this vicious cycle, because once you start getting hot flashes, men or women, any stress will also make you sweat.
Really?
Of course, when you are under stress, your palm will be sweating, your face might be sweating, right, your armpit. And any stress can make you sweat, and then you get really scared, because if you're on an interview or you're in a conference and you're a little bit under stress and you start sweating a little bit, you say, oh my God, here comes my hot flashes.
Well, no, when you bring this up, now I know there are some men that wear these, beautiful shirts, and they start, and all of a sudden they get so much water and perspiration.
Yeah.
And that's unusual.
That's very unusual.
But that's what you're saying.
And there is a treatment in my office for that.
Is there?
Yes, it is.
Is it Botox?
It's Botox.
I heard about that.
I treat many men and women in the palm of their hand because they sweat a lot. I mean, they grab a paper and the paper is soaking wet from their sweat. Or if they're going to shake somebody's hand, they sweating so much that it's like they just washed their hand and didn't dry it. And like you said, the clothes get all sweaty. So we treat that, and it's very effective. The Botox treatment is very effective.
Why is Botox effective for them?
Because what it's doing is interfering with the nerves that are innervating the sweat glands. And by interfering with that connection, then it stops the sweating. So when you are under stress, those glands are not the one that's going to be sending all the water like a fireman out of your armpit.
So would you, as a woman starts to age and she comes to you as a patient and she's had no hot flashes, would you start something for her ahead of time or just wait to see how it happens?
Oh, no. Regardless of the age. Hot flashes have nothing to do with age. Regardless of the age, we work up the patient. That's what should be done. And for the physician out there, when you go to your doctor and the doctor wants to take this as just part of aging and you have to live with that, that's not true. You have to, talk to your doctor that, no, you want to be worked up. You want to go get your hormonal level checked. And if they don't do that, then you need somebody that can, do that for you. The reason being because hot flashes can be related to certain medication. Certain food will produce hot flashes. There are people that when they drink alcohol in excess amount of drinking, they will develop hot flashes. That's alcohol related. So you can let them know if you're going to be in a social event. You have to be careful with the amount of alcohol you're going to drink because it will give you hot flashes for men and women.
But go back to certain
foods. Drugs.
Wait, go back to foods.
Oh,
what
food,
kind of foods produce
hot pepper,
this?
spicy food. Yes, the spicy food can definitely produce hot flashes.
Because it's hot, it makes your body hot, right?
Exactly. It triggers all the nerve ending, and it will produce the hot flashes.
Maybe I never ate spicy food. Maybe that's why I never.
In a lot of my patients, what I do, I review their medications, and I want to know what they have discontinued even within the past 3 months when it comes to medication. So when you go to the doctor, if you come to my center, you want to make a list of the med that you are taking, what drugs are you taking now, and also what have you discontinued within the past 3 months, because that becomes important also. So if the patient is taking antihypertensives, mood-altering drugs, so patients that are treated as bipolar, and they get mood-altering drugs, severe depression. Sometimes they get put on mood-altering drugs to get them out of the depression. Antidepressants themselves. There are some antidepressants that are very clean, very little side effect. When I have to use an antidepressant, I try to go for one of those drugs like Vibrate, Lexapro. So try to go with the cleanest of the antidepressant versus the one that can produce hot flashes on the patient. So sometimes it's a matter of switching antidepressant on the patient. The anti-anxiety medication can also cause hot flashes. So your medication, whether psychiatric or no psychiatric medication, it's important that you bring those up with your doctor that you want to treat your hot flashes. You cannot hide drugs from your doctor if you want to be treated.
People do that?
Of course, I don't want the doctor to know that I'm bipolar. It's only for between me and my psychiatrist.
Is that right?
Yeah, that's no.
Now isn't that funny? I can't believe that. I mean, you go to a doctor and you happen to be going to a psychiatrist. You don't tell your doctor.
I have a patient that was developing chest pain, angina, and. I said, give me a list of your doctors. Give me a list of all the doctors you go to. So, of course, he goes to a cardiologist because it's angina. He goes to a neurologist because he developed dizziness. He was very lightheaded. And I say, how long you been going to the neurologist? Say about, like 5 or 6 months, he said. And I say, okay, and he goes to a urologist. I say, why you go to a urologist? Oh, no, I was having some problem, but I'm okay now. Okay. So I'm trying to put the puzzle together. I say, because this guy shouldn't be having angina. He's very active, still young, in the early 70s. I say, there's no reason for this guy that never had angina. In 5 months, start getting angina. In 5 months, start seeing a neurologist for all that. So I try to be a detective, and I say, well, the urologist, did he give you the medication for your erectile dysfunction? And he goes, oh, my God, my wife told you about my erectile dysfunction. I say, no,
funny.
Never spoke with your wife. But
now that's...
I'm trying to help you here. So he goes, yeah. He was taking a very high dose, and I said, listen, I can help you with your problem. You won't have any more angina. You won't have to see the neurologist anymore.
That's what it is.
But we have to change your medication. I'll give you something for erectile dysfunction that will help you. And he cried, he apologized, he said, Dr. Mencia, I'm so sorry.
Goodness.
I was so ashamed, blah, blah.
That is so great.
So what are the symptoms of hot flashes?
Okay.
It's getting hot in here.
It's getting hot in here. Yeah, well, but I want everyone to know
it's the feeling of warm and spread through your upper body and face. Go ahead.
Andy, Dr. So funny. Dr. Andy Mencia, of course, is here with our wonderful world of wellness. And it's very exciting to have him here because he touches on so many topics, but he does it in such an easy to understand way. By the way, we did have a terrific show a few weeks ago on sleep apnea. The new Boomer Times and Senior Life is out. You'll be able to go to Dr. Mencia's office and pick up a copy. And there are some wonderful tips on sleep apnea. And our article is going to be on sleep apnea coming up this July.
But let them know the tips are on the advertisement section.
Yes, in the advertisement section you'll see the tips. And we did a whole thing on denture wearers on the article, which I thought was very interesting. I learned a lot from that.
Oh, Mike is great.
It's a whole thing you do there. All right, let's get back to the hot flashes. I want to ask you something,
symptoms,
though.
Yeah, okay.
Yeah, what are, the symptoms, aren't they just hot flashes?
Well, the person will flush, will get a flush appearance.
Oh, you mean they actually get red?
Blooded, they get this blotchy skin. So, it's embarrassing. It will also be associated with a rapid heart rate. And this is important because when you get a heart rate that goes up, of course you think of anxiety. That's why hot flashes and anxiety go hand in hand.
Well,
then the perspiration, of course, you start perspiring, and then that sure feeling at the end of the episode. Now, when you go through, so that you understand why this is nothing to be taken lightly, that you have to be worked up, because it can be treated. If we find the root of the problem, if it's not just hormonal imbalance, because beside the hormonal imbalance, in a man we say the testosterone, in a woman the estrogen and progesterone levels, but also infection can present itself at hot flashes, especially sinusitis. A person with severe sinusitis will look and will present with all the signs and symptoms of hot flashes. A person with a spastic colon, because the spastic colon can be due to yeast overgrowth. So the excess amount of yeast in the colon presenting in the body trying to fight this infection will present as hot flashes in both men and women. So when we do in men testosterone level, then the next thing we have to look is for infection, acid reflux, also a drop in blood sugar will present with both the hot flashes syndrome and the hot flashes picture, and also with the anxiety type of picture. And so when a patient blood sugar is dropping, we have to work them off for adrenal insufficiency, because it could be related to adrenal insufficiency. A lot of people, a lot of people out there, they don't associate hot flashes with chronic fatigue syndrome and fibromyalgia. So part of the presentation of chronic fatigue syndrome and fibromyalgia might be a hot flash-like syndrome, a hot flash-like presentation. So those people, they need to be worked up because they have a unusual type of sweating, and there is a scientific explanation why that's happening. Because there's a lot of doctors, they don't believe on fibromyalgia and chronic fatigue syndrome.
Yes, I've heard that.
The reason why that happens when you talk to your doctor is you have the autonomic nervous system. It's a dysautonomic function of the nervous system. So the autonomic nervous system that is responsible for your heart rate, your guts movement, your sweat gland, all of this, they will go crazy, and then you start either having palpitations, excessive amount of sweating. So it could be all related to fibromyalgia or chronic fatigue syndrome. I had a patient I put on Sabela for the treatment of fibromyalgia. Of course, when she started digging on the treatment, he said, well, why Sabela? It says an antidepressant. I said, no, it's not an antidepressant. It's a fibromyalgia pill. It's indicated in this country only for fibromyalgia. If you go on the internet, because in Europe we use it as an antidepressant, people get confused. But it's a completely different dose. And very important, that a overactive thyroid can give you hot flashes. So if you don't get worked up, if you don't get that ultrasound of your thyroid gland, get the hormone level to check. Now, sometimes when you go to your doctor, there is a test that they do called the T as in Tango, S as in Sam, H as in Hotel, TSH. That is only a screening test for the thyroid. If the person is having hot flashes, you don't want just a TSH. You want a full thyroid panel. You want a request from your doctor, and if your doctor is stubborn, say, I demand that you give me a full thyroid panel because I want to know why my hot flashes is related to my thyroid or not. So who is at risk of hot flashes? Smokers. So I always tell Ina, stop smoking. Smokers are at risk of
hot
flashes.
He keeps referring to Dina. Dina is sitting here. She works. Dina.
She works at
the office.
Yeah, she works the front and the back.
She's so beautiful. And you're from Russia, aren't you? Who are you?
Ultra.
Right. And so that's who Dina is. It's like a ghost. You keep saying Dina one day.
Yeah, it's like
she's sitting
ghost.
here.
Yeah, she can smile.
No, she's fantastic.
Yes,
just before you, and I know you have more to do, but I want to ask you a question because this is really important. So when people, and I would say, and I don't know why I'm even going to get these statistics, Dr. Mencia, but I would say that women just start having hot flashes and they accept it as a thing that they're having. And this is what's very important in the show. Please, you see, this isn't as simple as you thought. Your friends say, oh, we have hot flashes. No. Go to Dr. Mencia, have him work this up, and maybe you don't have to have hot flashes, but more importantly, there could be some very serious things that are wrong with you.
Exactly.
This is enlightening to me with this show this morning.
Excellent.
Like this.
Excellent.
I never heard all this.
Excellent.
Do you sleep at night?
Do I sleep? Very little.
I would say. This is amazing stuff.
I love teaching, so
this is amazing stuff. Okay, so who's at risk?
Who's at risk? Smokers, obese patients, people with a sedentary life, inactive individual, and then even some ethnicity. Check it out. If you are Japanese or Chinese, right? Nioma. That's Chinese for hello. Ohio gozaimasu. That's Japanese for.
We're going to start to have some.
So if you are Japanese or Chinese, they have less hot flashes than other races, and it's related to the food they eat. So we're going to talk about food and supplement as treatment, taking these people into consideration. If you are Caucasian, you are more prone than Japanese and Chinese. And Afro-American are the worst.
Is that right?
They tend to suffer a lot more hot flashes than Caucasian. The complications of hot flashes, especially if they occur at night, is sleep problem. Because you'll sweat that bed like crazy. So sleep problem, and which produce memory problem, no sleep, unable to get a good night's sleep, and then as a consequence also you can become very anxious and you can even get depressed because of that. So when the patient comes to my office, the workup is very simple. A good history on the patient, good communication with the patient on their history. You want to let the doctor know about any other medication you're taking, anything you have stopped taking. You want to talk to your doctor about any surgery, especially if you have had a hysterectomy, and any of those sort of things, because they become important. When you get your blood work with your doctor, you want to make sure that the hormonal level get checked. Your full thyroid panel, you get checked for diabetes, you get checked for anemia, your adrenal gland get evaluated, get checked for fibromyalgia, for chronic fatigue syndrome. That all of those things become part of the workup, and then eventually, if all of those things come back normal, also you want to include a workup for infection to see if infection is the cause. So the treatment is basically you want to evaluate your the medication and supplement that the person is taking. You want to do that with your doctor. If you do estrogen and progesterone replacement, remember that we can do the bioidentical hormones. If in a man, the testosterone replacement, same thing. If you're going to do herbal treatment, I had a patient that came in with severe liver damage, taking no medication, young guy, he's late 50, early 60, something like that. It was a few years ago. And he was taking the black cohosh, C-O-H-O-S-H.
Yes.
He was taking black cohosh because of hot flashes, which was due to testosterone deficiency, but he was never worked up. He would never go to a doctor because he didn't have a Medicare yet, so he had no insurance. And when he came in finally for a workup, because his girlfriend was seeing me with insurance, so he said, I've been doing this, and, I was having hot flashes. They went away, but, I don't feel good. My belly is swelling up. His liver, he developed liver damage from excess amount of black cohosh. So black cohosh can help with the hot flashes, but you have to be very cautious. You want to work with a physician that know what they're doing with this supplement, because it can damage your liver. The same thing if you take kava, K-A-V as in Victor A. If you take kava, it's excellent for the anxiety. If you are very anxious, you take some kava, it will help you, but excess amount of kava can damage your liver. So we have to be careful with the supplement. The Asian, they take a lot of soybean, and that's why you don't see hot flashes with Asians so much. So soybean pods.
You know what? I have not given your phone number, and we're out of time almost.
Oh,
so
my God.
You have to have a phone number. All right, everyone.
And you can take a handful of soybean pot every day. You can get it in the freezing section at the grocery store.
I had to give your phone number.
954.
I'm going to do it. 954-489-1345. 954-489-1345, the Adult and Geriatric Medical Center. What I have to tell you is Medicare and most insurances are accepted. Please call for an appointment today, because you can understand when we have this show, you can see that Dr. Mencia absolutely knows so much, and he brings up things that no one has ever heard of. So go make him your physician. You will be under the best hands, and we thank you so much. It's just been such a pleasure being here with you, Dr. Mencia. And we'll be right back after this other commercial.
And also, when we write the next article on hot flashes, on the tips, we're going to put some home remedies that we didn't get to cover.
What kind of remedies?
Home remedies. Home that we can do.
Home remedies for this?
Absolutely, yeah.
Okay, home remedies in our next article. You watch for the July issue. And you can also go to Dr. Mencia's.
It's getting hot in here. So take off all your clothes.
And get the magazines. Oh, my goodness. No show is ever like this after you leave. It's like a up and then
it's like
down.
A medical show.
Oh, I love it. Okay.
Bipolar. That's what happens when two bipolar get together.
Thank you, and we'll be right back with our next guest.
And we love you.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.